Let's talk about risk management, personal health, and well-being. One of the things that we recommend is that you strongly consider contacting your medical and or mental health provider, especially if you haven't had a checkup in 9 to 12 months. Keep in mind that if you have prescription medication, you may need to stock up or arrange to have access to new medication, either using a pharmacy or clinic near your new work site. If you are still at Emory, you can try to schedule rather, a travel consultation at the Emory University Student Health Travel Clinic. You can also check the CDC travel website to learn more about health risks and concerns associated with your destination. You might also develop a trip health plan, putting together a personal medical emergency kit that includes information about your prescriptions, an emergency contact list, and information about your health insurance. Speaking of health insurance, if you're covered by the Emory Student Health Insurance Plan, which is administered by Aetna, you can find out more information on your coverage by visiting the Aetna website or calling their toll-free number. They can answer questions about claims, billing, coverage, and anything specifically related to the Emory University Student Health Insurance Plan itself. As we mentioned earlier, every Pathways Funding awardee is enrolled in either Intern 496 or URP 499. In other words, every awardee is an active enrolled Emory student this summer while they're pursuing their experience. This unlocks Emory's telehealth resources, at least for experiences in the United States. If you are physically in the state of Georgia, you can access Emory Counseling and Psychological Services, known as CAPS, and the Emory University Student Health Services telehealth resources. If you're in the other 49 states, or actually also in the state of Georgia, you can access Timely Care. Timely Care is an independent company that provides services using a network of contracted providers in all 50 states. They're free and available 24 hours a day, 7 days a week for Emory students. That leads us to a couple of general tips about risk management. For example, take control of your personal safety by planning ahead. Think what you will do if you are caught in a bad situation. Envision the scenario and your reactions. Be mindful of applicable laws, protocols, and customs in your area, especially if you are traveling outside of your home country. It's never a bad idea to know where the nearest hospital or urgent care clinic is in relation to where you'll be living this summer. And it's usually a good idea to stay in regular contact with family or trusted friends so they have a sense of where you are and what you're doing, even if you're not living in the same city.